Hello and welcome. Today we're diving into the world of gastroenterology to understand a common, yet potentially serious condition called choledocholithiasis. We'll explore what it is, how it develops, its symptoms, and the various ways it can be treated. Choledocholithiasis, at its core, is the presence of gallstones within the common bile duct. But where do these stones come from? In most cases, they originate in the gallbladder, migrating into the common bile duct. These are called secondary bile duct stones. Less commonly, stones can actually form de novo, or spontaneously, within the bile ducts themselves. This is primary choledocholithiasis and is seen more frequently in some parts of the world. Let's talk about how these stones cause problems. The common bile duct plays a crucial role in transporting bile, produced by the liver and pancreatic enzymes, from the pancreas into the small intestine for digestion. When a stone obstructs this duct, bile flow is disrupted. This backup of bile can lead to increased pressure within the biliary system. Furthermore, the obstruction can cause inflammation and irritation of the bile duct lining, leading to a host of problems we will discuss. The obstruction can also affect the pancreatic duct, as both share a common outlet, increasing the risk of pancreatitis. Choledocholithiasis is a relatively common condition, but precise numbers are difficult to pinpoint. It's often associated with cholelithiasis, or gallstones in the gallbladder. Studies suggest that between 10 and 20% of individuals with gallstones will also develop stones in their common bile duct. Risk factors include age, female gender, obesity, rapid weight loss, and certain medical conditions. Now, what does choledocholithiasis feel like? The symptoms can vary depending on the size and location of the stone. Many individuals may experience no symptoms at all. However, common signs include right upper quadrant abdominal pain, which can be constant or intermittent. Jaundice, or yellowing of the skin and eyes, is another hallmark symptom, caused by the buildup of bilirubin in the bloodstream. Other symptoms might include nausea, vomiting, fever, chills, and dark urine. In severe cases, it can lead to cholangitis, a serious infection of the bile ducts, and pancreatitis, inflammation of the pancreas. So, how do doctors diagnose this condition? The first step is usually a thorough physical examination and review of the patient's medical history. Blood tests, specifically liver function tests, are crucial to assess liver health and bilirubin levels. Imaging studies are essential for visualizing the bile ducts and detecting stones. An abdominal ultrasound may be the initial imaging test, but it can sometimes miss stones in the common bile duct. A more sensitive test is magnetic resonance cholangiopancreatography, or MRCP, which provides detailed images of the biliary system. An endoscopic ultrasound, or EUS, can also be utilized. The gold standard diagnostic and therapeutic procedure is endoscopic retrograde cholangiopancreatography, or ERCP, which allows direct visualization of the bile ducts and removal of the stones. Choledocholithiasis isn't usually classified into types, but rather differentiated based on the stone's origin: primary, meaning it formed in the bile duct itself, or secondary, meaning it migrated from the gallbladder. Understanding the origin is important for determining long-term management strategies. The primary goal of treatment is to remove the obstructing stone. ERCP, as mentioned earlier, is a common and effective method. During RCP, a thin, flexible tube with a camera is inserted through the mouth, down the esophagus, and into the small intestine. The bile duct is then accessed, and the stone is either extracted with a basket or balloon, or the duct is widened with a small incision, called a sphincterotomy. In some cases, if ERCP is unsuccessful, surgical removal of the stone may be necessary. This can be done via laparoscopic or open surgery. If the gallbladder is still present, cholecystectomy, or gallbladder removal, is typically recommended to prevent future stone formation and migration. While it's not always possible to completely prevent choledocholithiasis, there are some steps you can take to reduce your risk. Maintaining a healthy weight, avoiding rapid weight loss, and eating a balanced diet rich in fiber and low in saturated fat can help. If you have gallstones in your gallbladder, discuss with your doctor the benefits and risks of elective cholecystectomy to prevent future complications like choledocholithiasis. The prognosis for choledocholithiasis is generally good with prompt diagnosis and treatment. However, untreated choledocholithiasis can lead to serious complications such as cholangitis, pancreatitis, and even liver damage. Researchers are continuously working on improving diagnostic techniques, refining treatment options, and developing less invasive methods for stone removal. Current research focuses on novel endoscopic techniques and the development of medications that can dissolve or prevent the formation of gallstones. These advancements hold promise for improving patient outcomes in the future.